Why does Eustachian tube dysfunction cause ear issues? Imagine your ears as tiny pressure chambers that need to stay balanced to work properly. The Eustachian tubes are small passageways that connect the middle ear to the back of your throat. Their job is to equalize pressure and drain fluid from the middle ear. When these tubes don't work right, it can cause a lot of ear problems. Eustachian tube dysfunction happens when these tubes become blocked or fail to open properly. This can happen due to inflammation from colds, allergies, sinus infections, or swelling. When the tubes are blocked, air trapped inside the middle ear gets absorbed by the lining, creating negative pressure. This negative pressure pulls the eardrum inward, leading to discomfort, a feeling of fullness and muffled hearing. The tubes normally open during swallowing, yawning, or sneezing, allowing air to enter and mucus to drain. But if they stay closed or blocked, the pressure imbalance causes the eardrum to retract. This stretching or pulling can be painful and impair the eardrum's ability to vibrate normally. When vibrations are reduced, sound doesn't transmit effectively through the middle ear, leading to what's called conductive hearing loss. That's why sounds may seem muffled or less clear. If the problem continues, fluid can build up in the middle ear, a condition called serous otitis media. This fluid buildup increases pressure and can make hearing even worse. It also creates a perfect environment for bacteria to grow, which can cause infections like acute middle ear infections. In long-term cases, persistent Eustachian tube dysfunction can lead to more serious issues, such as cholesteatoma, a skin cyst that may require surgery to remove. Common signs of Eustachian tube dysfunction include feeling like your ear is plugged or full, muffled hearing, ear pain or discomfort, popping or clicking sounds, ringing in the ears, and sometimes balance problems. Children are especially vulnerable because their Eustachian tubes are shorter and more horizontal, making blockages more likely. Factors like smoking, obesity, and frequent colds can also increase the risk. In terms of hearing health, Eustachian tube dysfunction is a major cause of conductive hearing loss because it interferes with how sound travels through the middle ear. When the pressure is off or fluid is present, the normal conduction of sound waves is disrupted, making hearing less effective. Treatments aim to relieving symptoms and restore normal Eustachian tube function. Managing allergies or infections with appropriate medications can help. Decongestants may reduce swelling, and in some cases, doctors might recommend surgical procedures like placing ventilation tubes in the eardrum. These tubes help equalize pressure and drain fluid, preventing further problems. Overall, Eustachian tube dysfunction causes ear issues mainly by disturbing the pressure balance and fluid drainage in the middle ear. This leads to pain, muffled hearing, and a higher chance of ear infections. Because it affects how sound is conducted through the middle ear, it's a key contributor to conductive hearing loss. If you experience persistent ear problems, it's important to see a healthcare professional for proper diagnosis and treatment.